Hi, everyone. My name is Katie Sheridan. I'm an nurse practitioner student at Auburn University. Most of you already know me, but I hope this video finds its way to new practitioners, new providers, new patients, because this is something that I really feel strongly about and hope that we can make a positive change in our oncology setting. So we're going to go ahead and start off. The purpose of this presentation is to educate everyone on the benefits that physical activity has on patients in the oncology setting. As we know, patients who are diagnosed with cancer are faced with treatments that have debilitating side effects. Research shows that physical activity has positive effects on these side effects and can greatly improve the patient's quality of life and help them maintain optimal function while they are undergoing cancer treatments. The purpose of the research was to answer the PICO question: in adult oncology patients, how does participating in physical activity compared to being sedentary improve quality of life and decrease adverse effects while undergoing cancer treatments? The search strategy was based in CINAHL. Initial keywords were oncology or cancer and physical activity and quality of life. It was all current data from 2015 to 2020 within the last 5 years, and all that data was peer reviewed. The summary of evidence was broken down into 4 categories: the physical activity during treatment, physical activity during survivorship, physical activity during palliative care, and adherence to physical activity throughout the cancer treatment regimen. The recommendations based on that literature were the patient should be assessed for current physical activity levels from the beginning of treatment and be given an exercise program tailored to patient-specific needs. That is level 1 evidence. The second recommendation for patients who are in the survivorship phase of treatment would be upon completion of treatment, patients should be assessed for decline in function and be given an updated exercise regimen. The third recommendation is that patients with end-stage metastatic disease should be included to exercise programs with special attention to safety. And the fourth one for dealing with adherence would be that all patients assigned a prescription for physical activity should have a point of contact within the healthcare team to promote adherence to treatment. The setting assessment where we tried to first implement or plan to implement this practice change is at the Montgomery Cancer Center. We started off by following a small subset, which was just a doctor's team. He sees about 200 patients per week, and the infusion nurse we followed sees about 75 patients a week. We talked to doctors, nurse practitioners, registered nurses, nurse navigators, and patient education nurses just to get a feel of what they thought the gaps in care were. They feel that the gaps in care at the cancer center were lack of provider knowledge regarding physical activity in the cancer treatment setting and lack of follow-up once it was determined that the patient was having some lifestyle struggles. Currently, you guys see a patient at the very beginning, and there's not a lot of follow-up about maintaining their lifestyle or implementing physical activity. This would obviously be a multi-step approach to implement this. There will be plenty of meetings within the healthcare team to review all of the assessment, to review the setting assessment and find where the gaps, how we can bridge the gaps in care, educate further about the physical activity, and review the patient kits that we would like to send home, and review handouts that will be provided during the office visits. Once patients have express an interest in participating in this, they'll be given a kit and a note will be placed in their EMR. The kits that the patient will be taken home will have dietary logs, activity logs, information about their current lifestyle, their goals, and they will be given a point of contact within the healthcare team to talk to whenever they need some reassurance. A 6-minute walk test will also be performed just to get a baseline functional capacity to just see where they are in their exercise journey. Another thing that we would like to do is that patients will have a monthly meeting to attend with other people who are in the project change, and they can talk to the nurse, that are there, the other patients that are there. We would like to maybe eventually get some outside people in, like physical therapists, occupational therapists, dietitians, exercise therapists, people like that, to further recommend exercise for these patients and give them a time to talk. The purpose of the project is to help patients no matter how old or where they are in their metastatic disease. So getting that data was not as important to us, but each patient will be assigned a folder and the initial survey along with 4, 8, and 12-week surveys. So once a month, they will meet with their point of contact and go over their surveys, give us feedback, see where they need improvements, allow us to give them advice for improvements. And then at the very end of the 12-week, we will do a comprehensive final survey and another 6-minute walk test and see if they've improved. All information on the surveys is self-reported, so it's all subjective data. And the project leader and the nurse navigator will be in charge of comparing all of that. The project leader, which is me, Katie, will meet with the healthcare team and additional facilitators to discuss results and further incorporation into the practice change. So like I've already said, the patients diagnosed are affected in all walks of life, and the research supports that physical activity has a place in the cancer treatment regimen. I would love to talk with anyone more about this. I would love for this to be forwarded to patients and other practitioners, even at other clinics, and I would love for them to reach out to me at the email provided here.